Welcome to the Deep Six podcast, where we make a generational impact on you and yours. What we do here is explore a 6-point model into your health, your life, and your journey while you're here. So let's dive deep and help you thrive, not just survive. Hello, welcome. This is Dr. Lewerenz from Longevity Health Institute and the Deep Six podcast. Welcome. And man, today I am so fired up and excited because my integrator, Naomi,
hello,
our IV registered nurse that helps us just rock it in the IV room.
Pull it all together.
Put it all together, yeah. But she came up with this idea and she's like, we want to talk about IV therapies and we want to talk about some of the innovative therapies that we do and for our patients and have done for, 15 plus years. And she's done in the industry for, even
about 20.
Yeah, for even longer. And it's a wonderful idea because we're talking always about our 6-point model. We're always talking about, hormones and genetics and gut health and, mind-body connection and all that and the importance of those. But we don't sometimes get too specific about things. And IV therapy is just so powerful, so important, so impactful. And we were just yesterday talking about how you've noticed versus a clinic you used to be at.
Right.
Where I go to that right away. But again, let me reintroduce you. I want everybody to know how, that sounds funny, clinical, certified you are, okay. But more like experienced,
right.
But in IV therapy and in this space, and, I'm certified in IV nutritional medicine and in our functional medicine program. I've done multiple courses just like yourself. And, but I want this, because you direct this, you run all our nurses, you run both offices, our
And you and I collaborate together on making this the best it can be.
Right, absolutely. And with the best integrity, the best products, the best results, et cetera. In, what is it? Probably, I got to think about this, about 16 chairs with 16 lazy boy chairs.
Right, and a mobile infusion nurse. So we can take it to your house, your business.
Yeah, exactly. So Naomi, though, here's her training experience. She got 3 advanced certifications in IV nutrition. She was working with and certified through a physician, Dr. Paul Anderson. Did a lot of research in integrative oncology research center, certified in heavy metal toxicology and infusionist. Participated in the NIH TAC trial to assess chelation therapy for heart disease, certified in injection therapy with mistletoe, started 2 IV practices that are still treating patients today, including ours, 18 years experience in integrative IV therapy. She's, this is crazy. 34 years as a registered nurse. Mm-hmm. And I love this. And she puts in here in her bio and knows how to give a shot that doesn't hurt.
Well,
but no.
What you care about is what happens when you're there.
100%.
Not what training I had.
100%. If you can do a shot or an IV in place and it doesn't hurt, that's key. That's very key. No one wants their arm or butt or hip or arm to hurt. Come on. So anyway, welcome.
Thank you.
And this is such a big topic, and there's kind of so many things to go over. But tell me at least your background start and what you started to do with IV therapy, because there's these med spas in every corner.
There are now. 20 years ago, it wasn't the case.
Correct.
There were a few integrative physicians that were doing chelation therapy and vitamins, and they were getting popular probably in the 70s and 80s. I told on the last podcast a story that I grew up in a home where my mom was a very innovative nurse, was an infusion nurse. I was involved in watching the success of these patients as I was growing up. And then when my own health changed as an adult and I started and found functional medicine, what happens is a lot of our patients have gut issues and they don't respond well to supplements. Their diets are limited. As a result of that, they have poor energy and have a lot of symptoms that they can't get rid of. And I saw early on as a nurse that IV therapy was helping people quickly get that energy so they could make better choices, have the energy to do the things that we're asking them to do about changing their lifestyle.
Yeah.
So once I got involved in that, I started to see that we want to prove why this works. We don't want to just think put together a formula that sounds like a multivitamin. You actually want to create formulas that work. And so I started being trained and participating in the clinical trial that the NIH was doing called the TAC trial to look at why chelation therapy works. Because for already 30, 40 years, people were using it for heart disease and removing heavy metals. But this NIH study was aimed at trying to prove it. So it was really interesting obviously we want to make an impact on our patients now, but I also want to make an impact on the future. I want this type of medicine and IV therapy only to grow in its safety, in its efficacy, and proving it. And that was part of that. So all of the training that I did allowed me to understand how to impact the patients, how to make them more comfortable, how to make them more effective, how to measure before and after results. And all of that helped me see like great outcomes with very low side effects.
Yeah.
And that's exactly what we want. We want to make these big changes in people's bodies in short periods of time that weren't happening when we were just asking them to change their diet.
For sure. And I want to stress this. So for the audience, let's back up just a second.
Okay.
So, the TAC trial, which is on, I believe it's 30 years now. I think last year
there's more than one TAC trial. There's two at least.
Okay. So, but it's a trial that is following and tracking the outcomes of thousands of patients doing IV chelation.
And after they've had a heart attack was the inclusion criteria.
Right.
So they had known heart disease.
Right. So, and what chelation is, just for the audience to back up. So, chelation is a term. It's actually a Latin term means to grab or to pull. And so they're often used amino acids, EDTA, DMSA, that actually help pull heavy metals out of tissue. So out of bone marrow, out of mostly fat, but out of organs, et cetera. And like you said, and this is super key because it has been shown decade after decade, not just efficacious, but safe.
Right.
So, and I mean, we can attest, but doing chelation, there's one thing you have to know. Yeah, that's why you need to know that you're going to a quality place and you experience people that are certified, right? Obviously, and experienced in IV therapy, but it's very, very safe and it's very, very effective. And we'll go over some stories, but you can pull out elements, you can pull out electrolytes, you can pull out iron, and you can zinc and
copper
and copper and some of these things that you just have to replace. And that's the only error I ever see. Not on our part, but what I mean is because we replace these, we nutritionally IV replace them and all that. But it's so beneficial and so safe, and sounds so strange to a lot of people.
It does,
because they're like, "What do you do?" But it's so effective. So tell me, since we're on obviously chelation, tell me your experience with it. Tell me kind of.
I've seen a lot of really quick turnarounds in patient symptomology. So I've treated patients after they've had a stroke and seen just overall improvement in function, improvement in their blood pressure. I've seen people who had peripheral vascular disease, and they within 6 to 8 treatments of chelation, which is not very many, that's 6 to 8 weeks, just had dramatic improvement in their symptoms. They were able to golf, able to do their full job, able to take on things exercise-wise, like their exercise tolerance would improve because their circulation is improving. I've also used it, and I say we've used it to remove the heavy metals that increase people's potential for diseases like cancer.
100%.
So heavy metals in the body, which we're removing with EDTA, cause a lot of chronic illness, everything from problems with the brain, the immune system, cardiovascular disease, increased risk for cancer. I mean, lead alone is a strong carcinogen in small amounts. So we know now, because we can measure heavy metals, and that's one of the things we're measuring, but we're also measuring like what's going on in their cardiovascular system. We're looking at before, like what's going on to find out what needs to be removed. How is it impacting their immune system, their inflammation? We're also looking at their cardiovascular status before, and we don't start with EDTA or chelation. We start with all kinds of other support to get them ready to remove these things, because we want to have a healthier patient come to that place of detoxifying their body. Or
so done right.
Done right.
Yeah, done right, you have to hydrate a lot, and you have to make sure that person is pooping. It sounds so simple and silly.
Very
Hydrating
simple
and
parts of
pooping.
detoxification. And one of the 6-point model of detoxification is that.
Exactly. And so because where's it going? I mean, first of all, we're all toxic. So if you're out there thinking like, well, I'm not sure if this is really relevant, come on. When we test, it's not usually if you're toxic,
it's what you're toxic.
How toxic and what is it? Because we catch we catch, mercury, we catch, cadmium, arsenic,
gadolinium, lead, aluminum.
These are all the time. This week I have one of our few cases with people, and you were mentioning this is really key. So we pre-test, and they're linked to cancer risks. They're linked to neurodegenerative disease. They're linked to cardiovascular disease. In fact, there's an old study that when they pulled out plaque in the endothelium of cardiovascular,
when they surgically removed
them, that over 90% of the plaque was heavy metals. And the reason, I always say this to patients, think of plumbing. Well, you have some soft plaque, you have some calcium buildup, the artery's getting more narrow.
Right.
Well, heavy metals stick in there. It's because they're a bigger specific gravity. They're going through your bloodstream and they're easy to stick in there.
Got it.
So, but what I was saying though is we pre-test, and then you were mentioning this, we post-test. And I will tell you 100%, do we not move the needle? They're gone.
A lot.
Yeah.
Almost to below detectable levels.
Mm-hmm. Yeah.
And it does take more than one treatment. People need to maybe have 8, 10, sometimes a little bit more than that, depending on what we're treating, but really good results. And that helps people embrace it. The other thing is the TAC trial showed that people who actually had chelation had effects for at least 5 years after they finished the treatment.
Yeah, and I love that.
So there's ongoing protection because you have improved nitric oxide, when you have improved blood flow, everything works better. Right. So you have a healthier individual with less potential for cardiovascular events or death.
Which does, when you think about and we're all about integrating system, integrating medicine, So we use medicines. I don't want to mistake this, but the traditional approach to, let's just say, pick one, cardiovascular health and primary or secondary prevention is just medications. Right. Yeah, you talk about lifestyle a little bit, but it's just medications. Take this drug, eat less, lose weight, doctor's out the door. Here we have a resource where you can literally comfortably, especially you, because your needles don't hurt, right? But you can comfortably sit in a lazy boy and you
take a nap.
Yeah. Go on your phone, go on your laptop or whatever. And, hour and a half, sometimes depending on the
treatment
patient.
Is at least 90 minutes.
Yeah. And literally within a few sessions, most of my patients that I've seen feel a difference because you mentioned nitric oxide going up, but we're actually reversing, and I know that's a strong word, but we're reversing the heavy metals. We're reversing the soft plaque that's built up. We're reversing, a lot of this. And like you said, even in the tech trial has been proven that these results last up to 5 years.
Right.
There's nothing out there that does that.
Right.
And it's safe.
Right.
And
you can stop and start it. So let's say somebody has a great result, but they still have a lot of risk. We would continue to evaluate, maybe need to do chelation again in the future.
Yeah.
But they already believe that it's been effective because they had tremendous success and quality of life as a result of implementing maybe the 10 treatments that they did.
Yeah. And I don't mind, talking about myself here as far as, my wife always says, you never mind talking about yourself.
That's true.
Literally, I don't mind mentioning this. I typically do about 6 of them a year. Just preventatively, and I heavy metal test, and I obviously do all the stuff we do in the practice, cardiovascular testing and all that. But I firmly believe, because I've seen the needle move on, meaning I've reduced and pulled out the heavy metals, and I'm waiting. I got about another 3 months before I do another coronary angiogram, to compare some minimal plaque, that I've found. But my point, and I do this in patients too all the time, but I just look at it as this: it's maintenance. We maintain our house, we maintain our cars. The number one,
we maintain our plumbing, our internal plumbing.
This is our internal plumbing, and number one cause of death is what? Cardiovascular disease.
For both men and women.
For 100%. And so we're not getting out of this alive, and we're not getting out of this with some cardiovascular disease. So why not implement some chelation? And you know, it's usually very well received. It's just it shocks me, to be honest with you, how, I mean, we're talking, I think it's 30, 40 years it's been around at least.
I think it's been around since the 1950s.
Yeah. You
So,
know,
yeah.
so a long time. So more than that. I mean, 50, 70 years maybe. But
Right.
but my point, at least that I'm aware of, and I know doctors, you know, I believe they're retired now, but in our area, some functional medicine, holistic doctors were doing chelation in our area, southeastern Michigan, you know, back literally in the 70s and 80s. And my point, though, is, you know, it's still very vague to people, like, or maybe I've heard of it, or what are you talking about? That shocks me. That does shock me.
It's true. It's not mainstream. There's not going to be as articles that you're going to find out about it. You're going to find out about it from your grandfather that had a heart attack, that found an integrative medicine doctor that did it and had an incredible experience and is alive and healthy as a result of it.
Yeah. No, but I guess what I'm bringing up is, it's so effective. We see, I mean, I can tell you case after case, because when we have well, I'll back up. The brain needs blood flow, blood and oxygen. You remember, I always say you need blood and oxygen to live. Okay. And one thing that's overlooked is we do carotid screening. Right. Medical, practices will do this when they think of stroke risk. But in our practice, we do carotid, ultrasounds all the time, because if somebody's got a 20 or 30%, they're getting upstream poor blood flow to their smaller arterioles in their brain, and the brain is very vascular, and, we need good blood flow and oxygen to the brain. And we will ultrasound people, and I know you've seen this.
Right.
All the time. We'll ultrasound people, and they have a 20, 30%, carotid plaque. And that is not that significant as far as a stroke risk at all. Right. But that's not normal. I mean, they weren't born that way. They're obviously, and that'll only build as they age and go. And women tend to, by the way, have a little bit higher stroke risk than men in the postmenopausal phase. And so I'll tend to screen them earlier, but I do in men also. Men more heart disease. But my point here is, after chelation, we'll ultrasound them, they're gone.
That's wow.
It's crazy. They're gone. I mean, and I mean, I can tell you that even when they're 60, 70%, we see reduction, but when they're 20, 30%, we can see that completely removed. And sometimes, I mean, like you said, it might take 8 chelations. There's no exact, but anywhere between
8 weeks of treatment to get that kind of a result,
right?
As opposed to what?
Yeah. You're extending life. You're extending,
right.
You're improving neurodegenerative effects. You're improving cardiovascular effects. You're reducing your risk for cancer.
Right.
It's really, really, really impactful.
It's very impactful.
Yeah. So give me, I know we got our menu here
of things that we do.
Of our IV, things. Tell me, because you're in the IV room. I mean, that's the thing is, me and the other practitioners order them.
You order them, and then we deliver and see the patients before coming in and what they're struggling with, and then we see the afters. And I'm not going to say one treatment is the most impactful, because many of our treatments we use together. Doc talked about using vitamin repletion and mineral repletion after doing chelation, but we find that everybody benefits from the vitamin IVs. In the 6-point model, we're always looking at detoxification and digestion, and very few people have optimal absorption of nutrients. So in order to get people feeling better quicker, we tend to do IV vitamins earlier. It helps with their energy. It helps with detoxification. It helps bring down inflammation. It helps turn their brain on in a way that we don't see. We use a specific type of B vitamin called methylated B vitamins in our infusions, and they're just so bioavailable, and they do so much to help with our neurotransmitters, to help with mood. So there's just an overall elevation in quality of life and energy. It can be non-specific, like I just feel better, but that's the starting place, is these vitamin infusions. And the vitamin infusions are not like what you would get at a med spa. We use our vitamin infusions. I mean, they're vitamin cocktails. I mean, they're all
personalized.
They're personalized because we're testing. We can add amino acids to them. We can add specific ingredients that that patient is needing, and it can transform everything from their energy, their detoxification, their gut health, their symptoms, their chronic headaches, their hair loss, in such a dramatic way, in usually a matter of a month. I would say people need 4 to 6 infusions of vitamins. Just like one meal doesn't make somebody healthy, one infusion is not going to change your life, but it's the stepping stone of like gradually doing them over a period of weeks. And we do recommend doing them weekly initially to make kind of some big changes.
For sure. And then we taper them
Right.
often, don't you find? Yeah.
Way more of a
we
maintenance.
taper them
Once a month, once every couple months. Yeah.
Yeah. And even myself, I'll do one if I'm going traveling and I feel good, but I'm just like, I don't want to get sick, or I want to make sure I feel good, on the trip, et cetera.
Right.
One thing that I know you experience, and you hit it in my, the way I see it in with the patient clinically is, we'll order them and say we just order 4 to 6 IVs. And just like you said, we're not a med spa. So these are personalized, very key, personalized, high dose vitamin C, B vitamins, minerals. Again, you can add amino acids, you can add glutathione, antioxidants, which are wonderful. So we personalize them. Big difference in a med spa is they're not watered down.
Right.
And
this is not a hydration IV.
This is not a hydration IV, and it's also, if you're getting, you should know what you're getting, by the way. So if you're getting an IV out there,
Right.
you're going to a med spa and you're paying, sometimes it's exorbitant fees.
Right.
You should know what you're getting. In our medical setting, in our functional, personalized medical setting, you're getting typically, sometimes in rare cases, right, we'll do 10 grams, 15 grams of vitamin C, but mostly we're doing 25 to 50 grams of vitamin C.
We are customizing it. We can treat small individuals, younger people that you need smaller doses. That's how we can customize. But we can go up higher depending on, because some of the chronic diseases need very high amounts of vitamin C.
Absolutely. And that's where you get the tissue, the cellular repair, the strong effect. And that's what we see. And the difference is, and that's what I want to state is, and I know you, because you're in the IV room, so you hear these stories, but, I've done IVs before. I don't know if they ever helped. Well, if you're getting 2, 3, 4, 5 grams of vitamin C in an IV, that's pretty Mickey Mouse.
You could put that in a vitamin you can swallow with a glass of water.
Yeah, exactly. That's we're talking actually trying to bypass the gut, hit your adrenal gland, hit tissue to get literally a health impact, and sometimes not immediately, but within weeks. You know what I mean? The number one place that I tend to order the vitamin IVs and the nutritional IVs is adrenal fatigue. And who doesn't
tell us what adrenal fatigue is? Because everybody's tired and wired.
I was just going to say, who doesn't have
tired and wired?
Yeah, who doesn't have adrenal fatigue? You know what I mean?
We're all pushing ourselves to the maximum performance.
Well, and demands are higher, nowadays, and we're go, and we're Americans, so if you can achieve A, you can achieve A plus,
right?
But no, adrenal issues, adrenal fatigue are obviously one of the 6-point model, part of the deep 6, which is the hormones. So they're adrenal hormones, DHEA and cortisol. So many people are burnt out; they're just going too much. Cortisol, big misunderstanding with cortisol, is cortisol is a stress hormone. It's a fight or flight hormone. You don't want too high. You don't want too low. Right. Too low is you're burnt out. You've been running from the tiger, for too long.
Right.
You know what I mean? So you've been grinding too much without enough recovery. The wired and tired is the acute stress response. That's cortisol too high. When we see either one of these, vitamin C and Bs are very critical to help restore the adrenal gland. In fact, vitamin C itself helps the adrenal gland make cortisol.
Right.
Okay, so, and you get 100% what we give you when you get an IV. You bypass the gut.
Right. Bypassing the gut has many mechanisms to limit absorption, even if you had an optimal gut.
Right.
So you get,
who does?
You get immediate tissue, all those vitamins right available and used. And so you get all that we're giving you immediately.
Yeah, and what I've noticed when patients come with adrenal stuff, and I went and saw somebody before, they say,
right.
And, I actually had somebody just a couple weeks ago, and they were very frustrated, had seen many practitioners for a couple of years on and off, no result. They had adrenal, they said, well, I was told this before. I was told like I have adrenal issues and adrenal fatigue. And so they're kind of skeptical and kind of upset about it a bit in the sense that like, well, what are you going to do for me? Well, they didn't do IVs, and they didn't in the past, and they did some herbals like ashwagandha, and they did some oral B vitamins and C and stuff like that. And of course, you have to get to the root issue always, which is why they're burnt out.
Right.
But to restore it, anytime I see, and this is more clinical, anytime I see somebody in the lower quartile of cortisol, I go rate 2 IVs, nutritional IVs, because they need big support. It's not just like, and these are people that are struggling. It's not just I'm tired. A lot of them are, not getting out of bed at times, or
Not sleeping.
depressive.
Right.
They, by noon they're tired. They get up and have 2-3 hours of energy, and they want to go take a nap.
Right.
You know what I mean? And yes, their whole circadian rhythm's off. So with sleep and stuff. So, but it's such a actionable, I think, and an impact when they do an IV of nutrition and their adrenals. I mean, it's unbelievable.
It gives them energy during the day, and also the ability to relax and sleep at night. The minerals, the magnesium that we can deliver also helps their whole body to relax. And I've also seen people with recurrent headaches.
Oh yeah.
That is, it seems to prevent headaches, treat headaches, because a lot of headaches are part of the stress response, muscle tension and hormone imbalances, and they're all triggered by that stress. So the IVs are very preventative. Even if people have been using all different types of medication, they find if they do consistent IV therapy, that would be like 1 or 2 a month, that they can keep them away, keep them less, and then they're not having to use a strong medication that puts them to sleep for the day.
Yeah, no, for sure. And you said something that just made me think of something that I've seen in the practice for years and years and years, and that is the magnesium effects with migraines, with headaches, huge. So for the listeners, if you're suffering from migraines or you're getting chronic headaches, there's many causes: hormonal, nutritional, stress responses, structural with your, neck, etc. But magnesium, super benign. You increase the tissue level of magnesium, which we can do intravenously sometimes, right? We do injectable, even magnesium sometimes for headaches and migraines.
Right.
Take them right out of it. I mean, in minutes sometimes.
Usually within 30 minutes, it's better.
Yeah, and that's that, and then they don't have that hangover, like you said, of their Imitrex or their migraine medicine, type thing. So, you brought up something else that just made me think of is there's so much nutrient depletion,
right,
in society. We see it in testing and all that, and so obviously IV repletion is so huge. What's your experience with that? I mean, why do you think that is?
Why they're nutrient deficient?
Yeah.
Well, a lot of times people are fasting a lot. They might be living on coffee for breakfast. They're eating the same 10 foods every week. We don't have a tremendous amount of variety. We don't have a tremendous amount of nutrient-rich foods. The foods that we do get that are natural, a lot of them have less available nutrients in them. And then our digestion, because of medications and stress, antibiotics, all of those things have changed how we absorb things. We have less beneficial bacteria, which help convert some of our vitamins and make them more active. All those things aren't there, and we are working on those things, but those are slow things to change. Right. And so we need to help people get that mental clarity by bringing those and delivering those IV nutrients. Like those methylated B vitamins can literally make your brain clearer within 24 hours after an infusion, and help you to be able to think and be able to do your job. I would say that brain fatigue and that mental tiredness is one of our top 5 complaints that people come in with, and why IV therapy delivers such quick results on that, why people come back for more.
Yeah, that's key points. Plus, and I can't remember the exact data on this, but I believe it's something like 70% of the U.S. population take a PPI, take a proton pump inhibitor like omeprazole, Nexium,
and that interferes with B12 absorption.
You don't absorb. You're blocking acid, so you're nutritionally not absorbing. Yeah, you've got a gut issue, obviously, and that's a whole one of our 6-point models that we got to fix. But in the meantime, while we're fixing it, we can replenish your nutrients. We can bypass that through an IV, and that's where people get really drastic, quick effects. So tell me another thing that your stories. I mean, I know we have many, but other things
do.
that we use in the IV room, in the 16 chairs, the 16 lazy boys.
I want to kind of finish the conversation a little bit more about cardiovascular disease with Plaquex.
Yeah.
We've been using chelation, which obviously is great for cardiovascular disease through the research and long years of use. Plaquex is it's a chemical called phosphatidylcholine, which makes up our cell membranes. If we think about how soft a baby's skin is, like when we're a baby, phosphatidylcholine is the majority of our cell membranes that makes their skin so soft. Mm-hmm. But as we
I'm
age,
lacking, by the way.
as we age, we tend to lose the healthy phospholipids in our cell membranes. Yeah. And that's really where everything happens when it comes to absorption and utilization and even energy is happening, like things have to come in and out of the cell membrane. So improving that cell membrane will improve overall response to any treatment, but also at the same time, phosphatidylcholine, when we take it, old-fashioned way of taking it orally was called lecithin. It was an old-fashioned supplement.
Yeah.
But when we deliver it IV, we get 100% absorption and utilization. So we start seeing things like people's cholesterol go down, their triglycerides go down, fatty liver can be diminished as a result of that. Just a lot of good things that happen in restoring the membrane. It can also help with tissue restoration. If somebody's had tissue damage as a result of a high sugar diet or as a result of a treatment, we can use phosphatidylcholine IV called Plaquex to help restore that. So we've seen results in helping maintain like marginal kidney function in some of our patients. Mm-hmm. So we love using this because diabetes and medications really destroy kidney function over time. And as we age, we see kidney function declining, and we want to protect that. How can we protect kidney function? One of those things, obviously, is looking at the things that's damaging it and what can we bring in to help repair and decrease how fast that happens. And phosphatidylcholine and Plaquex seems to help with that as well.
Yeah. Oh, yeah. So that's something that it's really impactful that Plaquex, because theoretically, like you said, the phosphatidylcholine is so important in cellular health and in cell, communication and protection in that. Like you mentioned, like where diabetics will get neuropathies and it'll help stuff like that. Or if there's brain, neurodegenerative stuff, sometimes we'll use that. Plus it reduces cholesterol.
Right.
So we'll see a reduction in cholesterol. So you're getting cardiovascular benefits, neurodegenerative protective benefits. But one thing, and this is an interesting anecdotal that I noticed in the practice. Now, for listeners, chronic kidney disease is pretty prevalent.
It is,
especially with aging. You know what I mean? So you have per volume more blood vessels in your filter of your kidney per volume per weight than any organ in your body. It's very, very sensitive to damage. And there's not a lot that can reverse it, meaning once that your kidney is kind of like suffering, if you will, and again, from toxins, from medicines, from, high blood pressure, from diabetes, from cholesterol over time, this is what happens decade by decade. There isn't much you can do about it. I mean, there's no meds on the market that really do much about it. They'll say lower your blood pressure, lose weight, eat right, et cetera. And those are all important things. But helping that gland, that organ actually work better, there's not much. And Plaquex is one. I've seen it where somebody's GFR, their filtration rate drastically improves. And basically, if we send them to a nephrologist, a kidney specialist, they would watch them and say, well, in 5-10 years, maybe 20 years, depending on their age, et cetera, you'll probably be on dialysis.
Nobody wants that.
And it's like prison. You're tied to this machine 3 days a week, horrible existence, So, and there's no, the end game is that's your life. That's, what I mean? So to have something, and why I speak so highly of it is actually, this because she's in the IV room. My mom.
Yes.
Have I not done Plaquex in my mom? Her GFRs, her kidney function is improved. Her filtration rate is improved. And she's 82. So let's be real. We're not going to reverse it all. Right. But I mean, she's nowhere near going to need in her life dialysis. And on a different path, that could have potentially happened, But we see so many benefits of Plaquex, and you can speak of it, but I never see any side effects.
So the one potential side effect is that you are excreting cholesterol via bile.
Well, yeah.
So when that happens, bile ends up obviously going into our digestive tract and we poop it out. So you can have changes in that.
Wow, yeah.
But we always ask patients, because everything we do is based on the patient response. We don't want people to feel worse after they have a treatment. And so we always ask them, how did any of those things change? Do you have any side effects after your treatment? And I have had zero complaints of the digestive effects that the literature says is possible with Plaquex.
It's pretty minor.
It's very
minor.
minor.
At least clinically.
It is.
Yeah.
But I do see like their cholesterol and their blood pressure like improving within a short period of time.
Mm-hmm.
And then the longer they do it, Plaquex would be something that you could do intermittently ongoing for the rest of your life. You could. Because it's so rejuvenating to cell membranes. And we always need that, especially if we've made our diet better and we really want to embrace a holistic lifestyle. We want to like put these foundational things in that change what our cell membranes are like so that we overall do better with everything we're bringing in.
Yeah.
So it is very safe, very effective, and can be combined with chelation therapy to get at both the different things that happen, the hard and the soft plaque that happens in.
You made me think of a patient, and great guy. He's about 50, and he has made some major health improvements when he came to us. I mean, he's down to about 50, 60 pounds. We got him hormonally balanced, got him exercising more, building muscle. We've used the 6-point model and worked with him, and he's dedicated. So we're tracking things. He's making big improvements. But I did discover heavy metals in him. Okay. And he was shocked. In fact, he was like, to be honest with you,
you don't see him and feel them, so unless we test, we don't know.
You don't. And actually, he was like, "What the hell, doc?" He was like, "Where do these come from?" And off the top of my head, I can't recall exactly, but it was typical ones: mercury, lead, I think tin. Which
aluminum,
aluminum, things that we exposed all the time. And he's like all about getting rid of them. He's like, "No problem. You just tell me what to do," because he's, he is doing so well and got so much health wise going. He's a lot more energy, et cetera. So anyway, we chelated him and got all those out, and I saw his cholesterol drop and I saw his blood pressure drop. And you brought up with, Plaquex and with chelation, but he says to me, and I do get this question once in a while, and it's interesting because 100% it's what I do, but it's, you should be doing them. You should be doing them periodically. Right. He's like, shouldn't I just do a few of these? As maintenance, if you will.
Yes.
Now again, he's 50. I'm not saying a 30-year-old needs this, but once you're developing this stuff and you've been on this planet, for a few decades, right. There is no harm and nothing but benefits to help you in the long game of true prevention, preventing cancer, preventing cardiovascular disease, neurodegenerative disease, dementia, all that, by doing some simple things like chelation and Plaquex.
Absolutely.
Yeah. So I asked him, I said, especially him, because we've solved a lot of goals. He's thriving where, he still needs to lose like 10 more pounds, but he's like doing wonderful. His numbers are all better. And I'm like, yeah, you should just put this on your calendar year by year. We'll do a handful of them and we'll keep tracking things, So I think that's really, really key. So tell me another. I mean,
I was actually interviewing one of our patients this week who had a severe stroke about 3 years ago and has come in, met with our nutritionist, done Plaquex, done Ozone, done EDTA, and literally has completely transformed his life and his health. And everybody asks him, what did you do to recover? Because nobody recovers from a stroke the way he has. A profound improvement. He's healthier than he was before his stroke.
He was using a walker. I know who you're talking about.
Yes. I said, what would you attribute any of what we've done in the IV therapy to help you? He said, absolutely. Yeah. I mean, obviously he's embraced a lifestyle and the IVs, and he just felt like all of those things really has improved his outcome, and he's thriving. Yeah. And will continue to do those therapies based on his past health history. Doesn't want to go through that again.
And I know who you're talking about, and I want to stress this. He takes 0 medication.
Right.
He did obviously post-stroke because he had some hypertension. He had some things but by losing weight, lifestyle things, exercising, some IV therapies we did, I believe we did a little hyperbaric on him, for a short term to help him recover. Mm-hmm. Long story short is he's not, it's not like he's on the typical,
protocol
3 meds, platelets and antihypertensives, and he doesn't need them. I mean, and we've screened him. We look at his vessels. We look at everything. He is doing amazing.
That's amazing.
That's it. But that's when you get like somebody that's dedicated. What's key here is.
But he wasn't dedicated until
Well,
something bad happened, and it woke him up. And now
a stroke will wake you up. I mean,
he could be a commercial for Longevity Health because he is doing amazing.
Yeah.
One of the things that we do a lot in the IV room is ozone therapy.
Yeah.
And ozone is like a word people go, isn't ozone a gas? That's something we don't want to
up
be breathing. That's in the air. And ozone or
which was
O3,
my first response too.
It was to me too. But ozone, when combined in an IV with your own blood. So let me just give you an example of what ozone kind of looks like in an IV room. We actually draw out about 60 milliliters of a patient's blood, and we put it in an IV bag with saline, and then we create ozone with oxygen, which is O3,
Yep.
and inject that into
oxygen.
the bag. It's
It's
extra oxygen.
Yep. Yep.
We put that in the IV bag, and then what happens is this transformation that the ozone does to the blood. We now then drip that back into the patient. It does some amazing immune modulation to the patient. It helps them with energy. It helps them with mental clarity. It helps clear viruses. We have seen so many amazing anti-inflammatory effects of using ozone, and there's no medication in it.
No,
so
it's literally your blood. And O3.
And O3.
You know, and so which is just ozone, which so the listeners, so ozone, like you said, is created. We take oxygen, we run it through a machine that has like a catalyst and actually causes an attachment of an extra oxygen.
Right.
And then once that is injected into something, in the body or wherever, it hits something organic,
Right.
It just makes extra oxygen. So that conversion is happening in the blood, in the IV bag.
Right.
And does it not change even the look of the appearance of the blood?
It does. The blood is bright red,
rich.
because obviously it wasn't before. And then we start to see within 24 to 36 hours after an ozone treatment, big changes in energy, changes in their gut, because what ends up happening is this ozone process activates system within our own immune system that starts changing how the immune system acts. And it doesn't create an overactive or an underactive immune system. Maybe that's why they're there. They have an overactive immune system, maybe an autoimmune disease. Yeah. And we see this help modulate the immune system. So the immune system responds more balanced, and they get less pain, less inflammation. It starts killing off some of the bugs that are in their gut. Like we treat fungal infections like candida a lot using ozone, and that really helps with them reducing their symptoms. It can reduce their abdominal bloating because this has a systemic effect. It's hard to believe that a small amount of blood like that treated can affect the whole body, but it does.
It does, yeah.
And we recommend about at least 8 treatments because each treatment is an increased dose.
Right, so we raise up the gamma.
We raise up the gamma each time they get treated so that they don't have side effects, they feel better and better. And usually by the 8th treatment, people are like, I'm so much better, I don't know that I need to continue to need this.
Right.
And that's usually when they're going back and having some of our gut testing done, maybe some of the viral testing levels that we do, and just measure like what changed, why are they feeling better, and we can usually tell a really big improvement within a 2-month period of time of doing ozone therapy from some chronic conditions. It doesn't cure, but it definitely does decrease symptoms, helps people recover from post-viral illnesses.
Well, yeah, speaking of that.
The post-viral thing we have seen and used extensively.
Yeah, so
post-COVID, post-flu, post-Epstein-Barr, any of those kinds of infections. Sometimes the immune system doesn't do a good job of like suppressing that virus, and the symptoms last for a really long time and really cause fatigue, brain fog, sometimes even like fevers is what we've seen in some of our patients. Start doing ozone, it allows the immune system to do a better job of making natural killer cells and just acting normally and doing what it's supposed to do, cleaning up what it's supposed to clean up. It does activate nitric oxide in its pattern too. So there's a lot of benefits that ozone gives that allow us to see a benefit in the brain, in the energy, in the inflammatory response, and the immune response, usually within like 1 to 2 months of a patient doing the treatments.
Yeah, and you did it with me.
Yes.
Post-COVID, I was fortunate enough to not, be hospitalized, if you will, But COVID, I always say COVID kicked my ass. And the reason is, from the outside, it may not look like it because I was out of the office for a week or 10 days, but I was really tired. I was just not myself. I was not energetic. I was not, I just felt icky. I felt inflamed, tired, moody. I just wasn't me. Right. And, of course, I'm not we always think as the provider, the doctor, like we always think like, I don't know if I need that, and I did all our vitamin protocol. I'm doing all this other stuff. So I said, well, you know what? I obviously know I need to do this. So I did Ozone. You obviously delivered it to me. Right. And I, off the top of my head, I think it was 6 or 8 of them. I think I did.
You did.
And objectively, I had some inflammatory cytokines in my blood that we tested. I had some high inflammation, some high CRP. I had some low white blood cell counts. So I had signs of a chronic virus that was causing leukopenia and some immune dysfunction, if you will. And I was getting sick often. In fact, I don't mind sharing this. I got post-COVID shingles, which was very common back, a few years ago, because your COVID, the spike protein and COVID itself, reduces the immune system. So it's very, very common. And then another virus kind of rears its head, if you will. After those 6 or 8 of them, I can't recall exactly how many, but after those, 10 pass higher doses of Ozone, I was fixed, 100% fixed. I mean, probably by 3 or 4, I was like, wow, this is making a big difference. My energy, my mood, my inflammation was like way better. And I completely resolved the shingles, the chronic shingles. And it wasn't a major, like I said,
But all those things are irritating.
Oh God, I would go to work. When you have a virus, by the way, when you have an active virus, 1 in 4 people have herpes. When they have an active herpes outbreak, even if it's, they are functioning, they will tell you they are tired. Right. If you have chronic shingles, you have a low shingle, varicella virus that's coming out, you are fatigued. There's documentation, 100% that they're neuroinflammatories. So you have brain fog, So, and Ozone is antiviral, antimicrobial. Actually, we got to mention about the ultraviolet radiation because that's antiviral, antimicrobial.
Ozone
that we do
is
Ozone with
delivered with an additional therapy called UBI, which is ultraviolet blood irradiation, and that sounds something like you do in a hospital, but it's a small light that is we're exposing it to the blood that's actually in the ozone bag. And it's very effective. In fact, before antibiotics, I was reading an article that I shared with you this morning. That type of thing was actually used to treat bacteria and infections before there were antibiotics. So it's known antibacterial, antiviral effects. So to be able to combine UBI and ozone together has this enhanced antiviral, antibacterial activity that is all done in one treatment, doesn't cost any more, but it really enhances the effect to do those 2 things together.
Yeah. And by the way, this is common physiology and science, old school even, and it really not even, it sounds unique and new. It's really, we know that down in the South, there's less viruses. COVID, there was less in Florida, less by the equator, et cetera, at times. Why? There's more light, there's more ultraviolet light, there's warmer climates, they're killing viruses more. And so, of course, we spin your blood through a tube that before it goes back in your body, that's just hitting all these different wavelengths of ultraviolet light. And that kills viruses and kills basically blood cleanser, if you will.
It is.
Yeah. And so smart to do, by the way, just because it keeps everything sterile anyway. But,
absolutely.
But I mean, it 100% has benefits. And what was so to me, obviously, years ago here with post-COVID, but any virus that we still see, people that suffer from shingles or they get a bad cold or, they, COVID's still around and they kind of, fight it, get better. Obviously death rates and hospitalizations are very minimal now, if any. But when they come in and they're like beat up from it, and we all get that way.
There's that 2 to 6 weeks afterwards that people are not optimal.
We give them an ozone or 2. Maybe sometimes we by the way, piggyback it, parlay it with vitamins. Some vitamins. So they're getting those both IVs, and within a week or 2, they're like completely better. And without those tools, sometimes they struggle for a month or 2.
Absolutely. I mean, we also use ozone in cancer. it's a good come alongside other cancer treatments because when you ozone helps activate our own antioxidants in our own healthy cells that help us to respond better, recover better from life, from intense treatments. So it can be used alongside other traditional cancer treatments that are harsh on the body and obviously do a lot of destruction. And anything that we can do to encourage and enhance our own body production of its own antioxidants for energy and recovery, tissue repair, all of those things, better immunity, helps a chronic disease, anybody with any type of chronic disease to actually do better.
Right.
And not be sicker, not get another infection, not be hospitalized.
Well, and a
Those
lot
are all
of
great.
it, we see this. We believe, and there's science to show this, and literature to show this, that's from viruses, from chronic viruses or bacterias or things that we've harbored. Also heavy metals and
metals, right.
toxins and all this. But again, another modality when we have an autoimmune patient, and we have many, many, many hundreds and hundreds of rheumatoid and MS and Hashimoto's and psoriasis and that and lupus and that when we're doing that, that blood, if you will, cleansing, that detoxification, that killing virus and bacteria, not only objectively do we see numbers improve, so call it like getting into like remission,
Right.
they feel better. I mean, their symptoms are drastically better. They're not cures. They're not
They're
cures
not cured,
with
but some of
autoimmune
them are
disease,
on less medication,
but yeah.
intense medications. They have less symptoms.
Oh yeah.
Most autoimmune diseases have many inflammatory components to them that are disabling.
Yeah.
And so this, in some ways, then actually helps with pain, not because it helps with perception of pain, but it's getting at that inflammatory
Response,
system
yeah. Oh,
in
yeah.
the whole body that is creating pain. And the other thing I've seen as I've studied ozone is you can use ozone just in a healthy person to help them to be more resilient and have better exercise recovery because, again, that internal antioxidant response that it's creating.
Yeah.
They studied soccer players, did like 60 soccer players over the course of 3 months and actually measured half of them did ozone before like matches, and they found that their VO2 max increased by 28% over the period of time that they were actually doing ozone. Their recovery, muscle soreness, and everything like that is improved.
Oh, yeah.
So like we think about using, as medical people, we're using it for these chronic conditions and to treat illnesses. But a lot of our tools can be used to stay
prevention,
healthy, prevention, improve the detoxification that prevents some of these chronic illnesses and horrible symptoms and debilitating things. We want to be using all of these tools earlier so that if people understand them, their capacity for change in their body, hopefully we can get people to embrace them earlier.
Yeah, yeah. Well, and it's because, I mean, it goes back to that, and I've said before, you know, in our space and what we see and do, and in the deep six and the 6-point model, you know, when we're looking at all these systems, people are living longer and sicker.
Right.
So you said something, there's, I call it our toolbox, but we have a bigger toolbox, right?
Right.
To like use these IV therapies to impact, you know, big chronic things that, but if you get ahead of it,
Right.
they won't show up so much as in your life, and your improved quality of life is there. No question. So there's a big IV thing we got to bring up. This, I don't want to miss it before we,
And
you know, tie up some things. And I do want to talk a little tiny bit about peptides, because peptides are all the rave and we've been using them for years, but you know, we see great results, but is NAD.
Yes.
And NAD is, and since we've been doing it, obviously IV, but also injectable, I can personally attest to many benefits, but tell us about NAD.
NAD is something that creates very quick change in the body. It is an infusion or an injection that delivers energy, improves immunity, improves like your mitochondria. If we think about the energy in our body to create change, to heal, we need that. How do we create that? Sometimes if we've injured that capacity through medications, even recreational drug use, NAD can be brought in to actually repair some of those things, to actually help the brain and the body change neurotransmitters. So we see it help with anxiety. We see it help with mental clarity. We see it help with people's immunity. We see it help with circulation. so many
Yeah,
things. It almost helps at every level because I feel like NAD has helped all of our other therapies work better.
better. Yeah, yeah,
And now that we've found a delivery, which is as an injection, that doesn't take as long, the potential of using IV NAD requires a longer time for somebody sitting in the chair, 2 to 4 hours, which can
yeah,
be a reason why people choose not to do it. Obviously, you can get more milligrams and get better benefits. But now that we can do injections at home, teach people how to do these injections of NAD, they are getting benefits that are ongoing that they can do by delivering it regularly and they're at home. And there many of our chronic fatigue patients, or even people that just need that just constant level of energy that they couldn't get any other way, that NAD is dramatically changing.
yeah. And I see in the last year or two drastic improvements in people that when we implemented that, even down to people that, and this isn't everybody, but everybody I think gets an improvement. But I mean, I've had 20-30% of people go, whatever that is, keep bringing it, because it's literally woke them up. Now, part of that I believe is because it does feed, the nicotinamide adenosine dinucleotide feeds ATP. It's fueling your
Right.
cells. It's
Right.
fueling your system. So how can you run on anything if you don't have fuel? You need fuel.
Right.
And our NAD levels go down with aging. So anything we can do to augment that or improve that, injections are easy. IVs are 100% more beneficial because you're getting a lot more volume, obviously. And you can do both. You can definitely do both. I personally, with most of my patients, get them, 100, 200 milligrams a week, injectable. I do that myself, but what is amazing that I hear, well, funny thing is that I hear is this: how can this help everything?
True.
But I think how it can help everything is because I always say this: it's helping. Essentially, the way I say, all your cells communicate. All of a sudden, all your cells, because of they're being fueled more, are communicating better.
Right.
So, of course, you can get better sleep. Your metabolic rate goes up. There's studies that show raising serotonin a bit. So your mood and anxiety get a little bit better. Your metabolic rate, they say, changes a bit. You can actually help a little bit of, energy and fat loss, but I think it does because it's hitting so many different things. You can say that, it's really helping everything. The higher your NAD levels are too, this has been proven, you get better DNA repair. And
That's really how we started getting into this. We started doing a lot more DNA testing and realizing we need to do some things to fix some of this.
Yeah.
And this was one of the things we brought in at the time that I think
because
made
we
a
were doing
big
mostly
difference.
IVs.
Mostly
and
IVs.
and those from a nuance, 2 hours in an IV chair. I mean, people do them, but they're not going to do them as often. Once you can start, implementing an injection that somebody can do at home. Now we're
It's a game
seeing
changer.
we'll be a bit more volume of people doing it, but I can't attest to, the benefit. I mean, the benefits are just numerous, so, it's funny. I've had a handful of people, like I said, that they've been like, whatever that is, man, within 1 or 2 shots, they're just like,
The effect of NAD seems to be almost immediate, so somebody can feel different usually that day.
Yeah.
And to have energy and also to be able to have good sleep, those are things that usually don't come together.
Right.
Like people love that. Like I feel refreshed, clear, and be able to have a good night's sleep. Those are things that actually NAD can help. We have many things that do that, but this is one of those things they can do at home.
Yeah.
That helps.
Yeah, no, I love it. I love it. This is why it's so awesome that we have all these, available, all these different things, you know what I mean?
Right.
And we personalize it, what might be for that person based on their goals or what we're seeing, NAD or nutrition or chelation or ozone.
Right. If a person lives an hour away from our office, coming in for an IV is inconvenient. So we're listening to you that we want to deliver treatment options that you can do without necessarily always coming into the office to get them. We realize an IV is a commitment of time.
Oh yeah. And we have mobile IV.
We do.
But yeah, that's not, but we'd like to have a lot of options, right?
Right.
And often too, there's, the body's intricate. So the different things will work in different ways, and parlaying a few things in this, kind of plethora of IV nutritional things and, therapies can really also, I find work synergistically, too.
That goes into while somebody's in an IV chair for 1, 2, or 3 hours, we bring in other treatment modalities into our IV room. One, we use red light therapy, which is great. We can do their whole body or their face, depending what we're working on,
Yeah.
because red light is great for reducing inflammation. It also helps stimulate collagen. It works on...
I noticed what's so
Yes.
funny is I go back in there and I love this just because they're getting fixed with their IV. You know, they're
Right,
getting
right.
their benefits of their whatever we're doing IV. And when I walk back there just to say hi or check on people, they got the
red light over their head.
face. So they
Yes.
got this like tube over their face. And
They're connected
and
to
they're-
molecular hydrogen.
And they're getting molecular hydrogen. It's a gas that's very anti-inflammatory, helps oxygenate the blood, very, very, very neuro-anti-inflammatory. And they'll literally walk out like,
I'm a new person.
I'm a new person.
Yes.
You know, and
Because
so,
we create synergy with using 2 or 3 things to optimize your time and really get those results.
for sure. Yeah, they're getting beauty, and with the red light, they're getting collagen.
Exactly.
They're getting beauty. Plus, I love
Right.
it. I love it. I probably need to do that. You know, I have not put the red light on while I'm in an IV chair.
Well, you can't be talking because you're underneath the light.
Yeah,
so
that's true.
There you go.
That'd be cumbersome
That
for
would be
me.
hard.
Yeah. So, you know, one other thing that I want to mention, just because we do it and you deliver it, I kind of created it, is the IVC facial.
Right.
And I want you to talk about that because you hear the patients, what they say, and explain what that is.
Right. So all of us are looking for ways to stimulate collagen, and that helps the appearance of our skin to have fine lines and wrinkles or any kind of like irritation improve, because collagen helps the integrity of the tissue to just look better, feel better, and react better to like anything you put on it. So we brought in the facial, and what that is it's microneedling, and we use PRP, which is platelet-rich plasma, which has stem cells in it from your own blood. So we are first giving you an IV of vitamin C, then we're drawing your blood and making PRP. PRP then has those stem cells that we are going to microneedle into your skin on your face and neck in order to stimulate that collagen in the skin. And then that combination plus adding the red light at the end of that for the overall healing response and stimulating of collagen is dramatic. It is really good within 2 or 3 days. People see changes in the integrity of their skin, fine lines and wrinkles start to be more minimized. And we've also seen adult acne improve because it decreases the inflammatory response that hormones can create in the skin. Yeah. And so I've done it on people who have like scarring from acne. I've had people that had different type of like surgeries on their face, like things removed, and they wanted to reduce the appearance of scars. But each of those things, the PRP, the microneedling, the red light, and the vitamin C are all things that stimulate collagen and give us an aesthetic, natural response that makes us look younger.
Yeah, yeah. And who doesn't want that?
And who doesn't want that?
Yeah. Who doesn't? I mean, everybody, mostly women, but everybody wants to look younger, and they'll get, hey, if you're doing this IV or you're whatever, hey, throw that on too.
You might as well do that too.
You might as well do that, right? Exactly. So we got to at least, before we wrap it up, I want to bring up peptides because there's such a big space. We could do a whole podcast on peptides, but we do parlay a lot of these together, don't we? So
do.
a lot of people are in peptides because they're fixing something, but they're getting IVs. Peptides we've been using for years. They've been in the medical industry for about literally 20, 30 years in Russia and Germany. A lot of studies in their countries based on peptides. There's over 200 peptides. And for the audience, what a peptide is it's an amino acid chain that's linked together that has essentially actionable by being that peptide to essentially tell the body and direct the body to do something, to improve something. So you are, you're managing a lot of these.
I'm mostly into the sourcing of that. You're into the, like what we use them for.
Yeah.
They have transformed people's health as, again, anything that we can get into somebody's body that they can do at home makes it an actionable thing that they can continue doing and get that continual benefits. And we use them many times stacked, meaning we're using 1, 2, or 3 peptides depending on what we're working on. So if we want to optimize a certain hormone, we'll give a hormone. If we want to optimize sleep, we'll give a peptide. If we want to improve recovery from a surgery, an injury, or a chronic inflammation, we'll use a certain type of peptide. So we will use them together because they have some synergy in doing all of that at the same time.
Yeah. One that I love, and we see huge benefits and have for years, is BPC 157. So it stands for Body Protective Complex 157. And that actually literally is hugely anti-inflammatory.
I have a great story with that.
And hugely reparative, right? I mean, there's studies on gut repair, ulcer repair, but go ahead. Yeah, tell us, please.
So I saw so many of our patients get an anti-inflammatory response of BPC. And as a nurse and doing IVs, my hands over years were developing arthritis. And I was like, I don't know if I can continue to do IV therapy because the ability to like grasp was getting worse. So I decided to try BPC. Within 6 weeks of being on BPC, the nodules in my knuckles and all the inflammation and all the pain I'd wake up with in the morning, completely gone. I stayed on BPC for about 5 months. I haven't needed to redo it. It has permanently changed my joints.
Isn't that
like
crazy?
I don't have that pain anymore, and I've been off of it now for over a year.
Yeah.
It was dramatic.
Well, and I have used it many times for injuries, a shoulder injury, a knee injury. In fact, actually, I had to save my Frenchie.
Right.
Banksy fell into the pool. I had to jump in with my clothes on and scoop
And
up
tore
Banksy. I
something.
literally tore my quad. And that did not feel good right by my knee. And anyway, so I probably was on it a good, month, 6 weeks, but each few weeks, better. I've used it in a shoulder injury that was bugging me for months. So not enough to need surgery or physical therapy, just like achy and all that. I can't tell you how many patients that we've used it for inflammation. So just arthritis, or they have a bad back or neck or what have you. Or they have a tendonitis that's, rotator cuff tendonitis or an elbow or something like that. They got a structural issue.
You end up doing it as a joint injection.
I do it
sometimes
as joint
putting
injections.
the peptide into the joint space.
Absolutely. Yeah. And again, this is very key, because why? It's part of our deep 6. It's part of our 6-point model, because structural pain things affect life. I mean, they affect, how we operate, and they disrupt sleep, and they make us miserable, and they make us where we then can't exercise and continue with living a healthy life, et cetera. And then you gain weight, and it's just like that vicious cycle. So fixing and helping structural things is super key. And BPC, there's others, but BPC 157 is one that I've noticed just immensely. I nowadays, versus maybe 2 years ago when I first started using it with patients, I will go to it with gut issues, significant, leaky gut issues, IBS, colitis, Crohn's. I go to it right away. I mean, if they're willing to, take the supplements, do the probiotics, do the diet, but I go, look, you're just going to speed this up immensely if we use BPC. And it works all the time. I mean, that's a big statement, but it works all the time. All the time. I can't, it's amazing. The one I also want to mention, and again, we could have a whole podcast on peptides, but is ipamorelin, tesamorelin, these growth hormone releasing peptides, samorelin, and they're all a little different, but these are growth hormone releasing peptides. So again, we're not giving you, because I'm not a big fan of this, anything exogenous growth hormone. But as we age, growth hormone goes down. It's a repair hormone. It's an anti-inflammatory hormone. It helps literally tissue repair. So like muscle repair and muscle mass. It has effects on lean body weight. It helps fat loss and maintaining weight. So anything you can push that growth hormone level up a little bit naturally, which is what these growth hormone releasing peptides do. It's amazing. I mean, because it hits the pituitary. So you hit the pituitary and you have that trickle down effect and that pulsatile effect of growth hormone. I see people lose weight, sleep better.
Right, sleep.
What
I noticed, I took ipamorelin, the ability to be able to maintain muscle mass without quite as much resistance training. I mean, it was amazing.
Yeah.
So if somebody is sedentary temporarily because they're recovering from a surgery, using that with BPC, you're getting two things together that's supporting something that naturally...
Yeah, tissue repair, building, and anti-inflammatory.
Right.
So it's like a win-win. I have somebody right now, I can't say names, that he's a big musician, that had elbow surgery, and he's off tour right now, and because he had he had to have a structural surgery. I mean, he had a legitimate surgery, but to help him repair, I put him on tesamorelin and BPC for the next 6-8 weeks just to help him repair and recover. I check in with him every few weeks. He doesn't live in Michigan, but he's like doing great, man. No pain, no inflammation. He's doing great. Yeah. So,
so the big thing for us with peptides has been that we want to use a pure product.
Key.
There are a lot of manufacturers of peptides on the market that can be accessed without prescriptions, and those are in a completely different category. They are not tested for the purity that we're using. We don't see side effects with the peptides we're using because we are using vetted compounding pharmacists that are testing, third-party testing for no endotoxins, which will prevent the side effects that happen when you're not using a clean product.
Yeah.
So we're getting a huge amount of recovery in people's symptoms and even underlying inflammation, as well as they're not getting side effects from them as well.
Yeah. Yeah.
We will not recommend people buy them from anybody except through a doctor who knows how to use them.
Well, yeah, that's the big thing is right now it's in vogue. It's on, social media everywhere and all that is, and you can go on the line and you can order peptides probably coming from China, called the gray market or the black market. You don't know what you're getting. We know you're for sure probably getting it laced with lipopolysaccharide, which is an endotoxin. So you're going to get a inflammatory response.
The opposite of what we're going for.
And they typically put on them for research or animal use only. Right. Meaning they're not used for human consumption.
I mean, you shouldn't be using those.
Yeah, which would mean probably shouldn't use that. Right. You know what I mean? Right. And so very key. Plus, you really, to get a result, you have to know, you have to have medical direction. You have to have some experience. We've had experience with these for years. I did a certification in peptides. So, that's really key because, this gray market or black market out there is where people get into the weeds and it's, not the best result. The one thing I want to mention before we wrap it up on a peptide is the nasal spray C-Link. Because it is a lot because it's excellent to calm the brain. Hits GABA, calms the brain, upregulates the GABA receptor. So people that have high anxiety, people that nowadays, who doesn't, right? But people that have high anxiety, people that can't sleep, and of course, there's many layers that can create anxiety, hormones, stress responses, literally the gut, because they're lacking some amino acids and that affects neurotransmitters. But having something that with literally a nasal spray, I mean, you can speak of experience, but I noticed it like the first dose, the first use.
It's probably the one thing that people buy over and over because they are so excited about how quick it works and the benefit they get from it. Calming the brain, that excitability that prevents you from being able to fall asleep at night or just having an anxiety attack, all of those things is what C-Link can be used for. But it actually helps with cognitive performance too.
Yeah, there's There's some animal studies on that. There's some C-Link and C-Max, and but I have many patients that I have them because they're like, I fall asleep, and what you've done for me before, I feel great, but my sleep is better. It's better, but I'm still only getting like 5 or 6. If I could get just 7 or 8 on the weekends,
then I would feel my best.
And I literally will have them put it on next to their, on their, because it works within like 10, 15 minutes. I mean, some people notice it like instantaneously, but I have them put it next to their where they sleep on their shelf there or bedstand, excuse me. And they will literally I just said, hey, if you wake up at 2 or 3, just do a spray or 2. And you'll probably just, relax and go back to sleep. And what's super key to this too, is this is what I love about this kind of medicine that we do, the synergy and the things that people do. So when they're doing that, by the way, and let's say the biggest natural growth hormone release is 10 p.m. to 3 a.m. Okay. That pulsatile. So out there, by the way, so make sure you're sleeping between 10 p.m. and 3 a.m. That's when you're getting the most natural growth hormone pulsatile release. So staying up late, you affect that. Right? Okay. Anyway, so when somebody's using, C-Link to help them go back to sleep or stay asleep, they're also affecting growth hormone, their natural growth hormone production. So then they get those benefits, and that's why when you don't sleep, you get all these downstream, like, oh man, I'm not sleeping. I feel like crap. And this is happening, that's happening, et cetera. And aside, it just kind of came to me that I want to mention too, because I wasn't aware of this, but I just read this, that BPC upregulates our natural growth hormone receptor. So when you're using BPC, you're also having some benefit to help your growth hormone, your natural growth hormone, work better, essentially. Right. So so that's also why it's been beneficial. So man, we could, Naomi, we could talk about peptides, IVs.
This is not a magic wand, but there are so many new and improving tools for us to be able to help people to feel their best and optimize their health and for the rest of their life.
Yeah. Amen. And want to stress one more time, you always want to fix your systems. So you always want to get into the 6-point model. That's why the deep 6 is we deep dive into your gut restoration, your genetics, your hormones, your mind-body connection, your detoxification, and helping your gut health, helping all of these systems work better. Okay. That's most important, but you need tools like IV therapy, peptide therapy, hormone therapy, etc., to give you the result you deserve. This is Dr. Lewerenz. Thank you again for joining us on the Deep 6 podcast as we're helping you create, like I said earlier, actionables so you feel better, function better, thrive, and not just survive. We'll see you again soon.